If you've had radiation, had lymph nodes removed, or you even had things like a mastectomy, or even breast augmentation or a tummy tuck, and post medical treatment, you've developed lymphedema, you're going to want to watch this because we're going to talk about different ways to address it. Now, what is lymphedema? Lymphedema is a buildup of lymphatic fluid. And ultimately what happens is our body isn't able to clear the lymphatic fluid that is being made in that area. Now, our body, every cell, tissue, gland, organ, is going to produce lymphatic fluid. And it's because it's the byproduct of cellular metabolism, meaning making energy from the blood and nutrients that is delivered to that tissue. So that's going to continue to happen. The problem though is when we remove or alter our lymphatic system, it is going to change how our body is capable of draining and removing that lymphatic fluid. Now, what you're going to want to know is manual lymphatic massage and drainage can be very beneficial, especially when it's done appropriately for you. And that might look different person to person. Now, what does that even mean? Because you might be like, Dr. Kim, what are you talking about? Here's the thing. I teach a ton on lymphatic drainage, especially lymphatic drainage when there's congestion and hasn't been a whole lot of alteration per se. Doesn't mean lymph nodes were removed like tonsils or adenoids or, a sentinel node or something like that. However, I don't teach a whole lot publicly on what to do when lymphedema ultimately is a result of having cancer treatment. Now, why? Reason is everyone's going to respond differently. So how I always start when I'm working with somebody is I always have them start doing everything as if their system was not altered. Meaning, you still have to learn the order, the direction, and the pressure. That's not going to change. That's where we start. And we see what happens. For a lot of people, they actually do see amazing results and get great benefit by doing the exact same thing, even though they may have like fibrosis from radiation, even though they may had all of the lymph nodes removed in their armpit. They can still see amazing results implementing things the way that I teach it. But here's something that's super interesting that we do have to consider. If when you go through and you're consistent and you're doing it over and over daily, because it is going to have to be a daily thing, and you're like, I am not budging the needle, this is not helping. Here's a couple things I'm going to encourage you to look into, because you might need to do something a little differently based on how your body is functioning now. The first thing is the pressure. Normally, it is feather light pressure. We are gliding. We are not digging or pushing, like nothing like that. It's just feather light. We glide across the skin when we're doing lymphatic drainage. However, there is some research that has come out of Australia saying that some individuals where they've developed lymphedema post-surgery might benefit from a stronger pressure. Now, it's still not going to be like a deep pressure massage, but it's going to be a deeper pressure than that just gentle gliding, like feather-like pressure that I teach quite often. So you may need a firmer pressure. That would be the first thing I would look into. The second thing I would look into would be you might actually have to drain the fluid in different direction than it was intended to pre-surgery. Meaning, instead of moving the fluid into your armpit and then into your termini, you may actually have to move the fluid either down into the groin lymph nodes, which have not been altered, so that it can be picked up. Or you may have to work with the watersheds, because we have a few watersheds in our body which ultimately allow us to manipulate where we move the fluid. You may actually have to move the fluid from the affected area across the body to the unaffected area. Everyone is a little bit different, but working with somebody that understands these things is going to be really beneficial and super important so that you can get the best results possible. But here's what I will say. If you're under active treatment, talk with your oncology team first to see if implementing this right now is the right time and right thing for you. They may tell you to wait, they may tell you to hold off based on your unique situation, where you're at and what you have going on. If they give you the okay, go ahead, I 100% would start with at minimum the specific 7, which is the lymph nodes that I always talk about. That's the minimum that we should be doing, or the total 12. You can also be more site specific, meaning if you have more lymph fluid accumulating in certain areas, like in one foot or in one arm, you may want to do the full body once and then do a second time or a third time site specific to make sure that you're clearing that fluid. And why you want to make sure that fluid clears is because fluid, when it sits there and it accumulates, is going to cause further breakdown. It's going to drive inflammation, which is going to, in the long term, cause more problems. I hope this was helpful. And if you want more information on this topic specifically, comment below. Let me know that this is something that is of interest to you, and I'll be sure to come up with more videos to help support you and your drainage. Thanks for being here, and happy draining.